Thank you so much for doing our interview for us. Our first question is, what is leukemia and how does it affect blood and bone marrow?
So you're so welcome. Leukemia is basically a general term, which means that there's some type of cancer within the blood cells. And the way that it affects the blood and the bone marrow, which is where the blood cells are basically born, is that it causes them to basically become haywire. The white blood cells can be really high or they can be really low. But either ways, it causes them to not be able to fight off infection the way that they're intended to. And then the red blood cells can be really low, which causes difficulty with oxygenating. And then the platelet clotting cells can be really low, which would be causing difficulty with clotting.
And what are the main types of leukemia and how do they differ?
So the main types of leukemia, it could be split into chronic versus acute. The acute leukemias are the more fast growing, the more aggressive leukemias. The chronic ones are a lot more slow growing. And then the other subset that we could talk about is that there is myeloid and lymphocytic. So the difference between the myeloid and lymphocytic is that the myeloid leukemias occur within the myeloid cell line in the bloodstream. And then the lymphocytic leukemias occur in the lymphocytes, which is the type of white blood cell. So that basically means that there are four overarching types of leukemia. There is acute myeloid leukemia, there's chronic myeloid leukemia, there's acute lymphoblastic leukemia, and there's chronic lymphoblastic leukemia. So the acute myeloid leukemia, or AML, that's the most aggressive. It's very rapidly growing. We see it in adults more so, but it can also happen in kids. And then the acute lymphocytic leukemia, or ALL, that's actually the most common type of cancer in children, but we can see it in adults as well. And then CML and CLL, chronic myeloid leukemia and chronic lymphocytic leukemia, they're both slow growing leukemias that occur more in adults after like middle age.
What are the common early signs and symptoms of leukemia?
So I'll start by saying that symptoms that most of my patients report early on are really nonspecific. I wouldn't call them like late or early symptoms. Some patients have really minimal symptoms, if any, and then some can be really, really ill. So it does range. But in general, many of my patients do report like flu-like symptoms. So they feel like feverish, they can have sweats, they might not really want to eat, have no appetite, and sometimes they can feel like lymph nodes that are swollen. And then there are also some patients who notice bleeding and bruising, or something called petechiae, which are like these little tiny dots all over the body that is due to bleeding. But in retrospect, many of my patients do realize after they're diagnosed that, hey, when I brushed my teeth or when I flossed my teeth, I saw a lot of bleeding and it just wouldn't stop for so long. So we do see a lot of that.
Okay, how do symptoms vary between acute and chronic forms of leukemia?
So patients with acute and chronic leukemias can have the symptoms that I just mentioned. But many of the patients with chronic leukemias, sometimes they don't have symptoms at all, or if they do, they might be like really mild. They might just progress really slowly over time. Many of my patients with acute leukemias, they have symptoms that, like I previously mentioned, the most often that I see is like bleeding, fevers, and fatigue.
So what type of symptoms indicate that leukemia may be progressing?
So when talking about a patient with like chronic leukemia, say that patient presented with fatigue as their only initial symptom, and only like all we were doing for them was monitoring their blood work and their symptoms. If I was worried about a progression from a chronic leukemia to more of an acute leukemia, that patient they might now have more worsening fatigue. Maybe they have some unexplained bruising. Maybe they have some unintentional weight loss. And maybe the labs that we've been drawing to monitor their blood counts, maybe those are getting worse and they're requiring a lot more blood transfusions. So those kinds of things might make me think in my mind, like, hey, this might be progressing into something a lot more acute.
What blood tests are used to diagnose leukemia?
So I'll say that many of our blood tests are done with machines, right? Like a complete blood count, or a CBC. That's a really great way to start. That test will give us lab values like a white blood cell count, a red blood cell count, a platelet count. But what we typically like to do is we add on something called a differential to that complete blood count. And so that will help us learn what each type of white blood cell count is, because there are several different kinds of white blood cells. And then one test that's really, really helpful, that's not just a machine spitting out numbers, but it's someone actually looking at the blood under a microscope. It's called a peripheral blood smear. And that really helps us understand like what the shape and what like weird things are looking like in those in that blood. And it might help us kind of know if we're worried more or we're more suspicious about a leukemia. But the only way to really confirm leukemia instead of just be suspicious for it on lab work is by doing a bone marrow biopsy.
Okay.
How is the bone marrow biopsy performed and why is it important?
So the way that we perform bone marrow biopsies is by inserting quite a large needle into the patient's bone. It's usually on either side of their lower back. And then we aspirate or we extract some of their actual bone marrow, which is basically like a thick liquidy substance. And then we send that off to our pathology lab for some special testing. And then we also send off like this tiny little sliver of the patient's bone as well. I like to explain it like I'm coring an apple, but instead of an apple, I'm actually coring out a sliver of their bone. So again, the bone marrow biopsy is important to perform for actual confirmation in diagnosing leukemia. And then we're able to do like really cool fancy tests on the bone marrow, like genetic testing of the actual patient's leukemia, next generation sequencing, which is like a fancy word for DNA sequencing. And then we do some chromosomal test on it as well.
What imaging techniques are used in the detection of leukemia?
So every patient that comes onto my hospital unit with a new leukemia will get a pan CT, which basically means it's a CT of the whole body. So we'll scan their head, their chest, their abdomen, their pelvis. And this really helps us learn if there's any kind of bleeding or infection that's going on, because we know that leukemia can cause bleeding and infections. But it also helps us see if there's kind of like any enlargement in the patient's spleen and their liver and their lymph nodes. We also do an echocardiogram, which is an ultrasound of the patient's heart. And that helps us see how well that heart muscle is actually squeezing and pumping. And that will assure us that the heart can handle chemotherapy that we might need to use on the patient in the future. And then if the patient reports any kind of specific symptoms, like say the patient's like, oh, my sinuses are really, really like they're giving me a lot of pressure, or like, hey, my left leg is like really, really throbbing, then we can expand like that imaging search. We can do like a CT of the patient's sinuses, and we can do like an ultrasound or an x-ray of that patient's left leg. So it's really, really important to do a really detailed interview with the patient or maybe the patient's family member, and really just listen to all of their symptoms, because it's not only helpful in diagnosing the leukemia, but it's also really helpful in treating the additional issues that might be present.
What are the common risk factors for developing leukemia?
So family history could be a risk factor, prior exposure to different kinds of chemotherapies, radiation, chemicals, that could be a risk factor. Smoking, as well as a few different viruses, could also be a risk factor. But I will say that a person having multiple risk factors doesn't always mean that they're going to get leukemia, right? And in turn, people who actually do get leukemia, sometimes they don't have any known risk factors. So I think it'll be really interesting to see in the future with more and more research if we can come up with more like solidified risk factors.
How do the genetic mutations influence the different types of leukemia?
So the special initial diagnostic testing that we perform on the patient's bone marrow biopsy is really helpful in helping us understand that leukemia's genetic mutations. And by actually having this information, we're able to tailor the patient's therapy and treatment options and medications a little bit better in a way that we feel they will more likely respond successfully to the treatment plan.
So what type of lifestyle factors could like develop leukemia or like progress the symptoms?
So I would say that like a prolonged exposure to chemicals like benzenes, formaldehydes, pesticides, those are maybe some things that a person might be able to avoid, whether it be like switching their job or something, maybe moving from somewhere else, maybe like not near like a chemical plant that constantly has those kinds of things. And then also quitting smoking is something that a person can do.
What treatment options are available for each type of leukemia?
So the chronic leukemias can be treated with something that we call watchful waiting, but some of them might require chemotherapy. The acute leukemias typically do require an intense type of chemotherapy regimen and sometimes even a stem cell transplant after. Stem cell transplant is where we get rid of all of the patient's bad cells and sometimes a lot of their good cells as well. And we replace the body with these new cells from a donor in hopes that the recipient takes those donor cells and builds a new immune system with it. Targeted therapies, immunotherapies are some newer treatment options that weren't available several years ago. There might be some options for clinical trials for patients. And then in some patient populations, palliative type treatments might be the way to go.
Okay, thank you.
What role do stem cell transplants play in curing leukemia?
So some acute leukemias will require stem cell transplant, but there are several factors that go into making a treatment plan decision to proceed with a stem cell transplant. And the most important of those is determining whether that transplant's actually needed or not. And this really depends on some of that initial pool diagnostic testing I was mentioning. Those tests help us stratify the patient's leukemia into a particular risk category. And then other factors that play into if a patient is a transplant candidate includes like their age, if they're able to find a related or an unrelated donor, as well as if they can find a 24-hour caregiver to be with them to help them through this really difficult time.
How do healthcare providers monitor for remission or relapsed leukemia patients?
So when a patient gives so many months or maybe even years of their lives to us battling their leukemia, they typically understand that, it's important to keep those follow-up appointments for things like surveillance blood work, symptom checks, restaging bone marrow biopsies. Those are all really, really important. And we as healthcare providers, we work really hard to express how important that is for our survivors.
How do survival rates differ between the various types of leukemia?
So we can look at that in more of like a 5-year survival rate to answer the question. So like the chronic leukemias have about a 70 to like a mid 80% 5-year survival rate. Acute lymphoblastic leukemia or ALL, in children, it's got like a 90% 5-year survival rate, but if it's in adults, it's only about a 40% survival rate. And then acute myeloid leukemia or AML has about a 30% 5-year survival rate. But then this drops really low to like even the single digits in those who are over like the age of 65.
Okay, so for our last question, what are the most promising areas of current research in leukemia treatment?
So I think it's really great that we're able to take these patients through more of like the traditional chemotherapies and stem cell transplants in a more safer and tolerable way because we're just better now at treating side effects. But I would say that many of us are most excited now about immunotherapy. Many leukemias were treated very similarly for the last several years. And since I've been in my field now, I've been able to see so much research go into practice with the approval of like things like targeted therapies, immunotherapies, like CAR T cell therapy, which is so cool. It's like we take a patient's T cells, we genetically modify them in a lab, and then we put them back into the patient. So they've now got like a task of destroying cancer cells. It's just like really fascinating, and I can only imagine what's to come in the future. I'm really, really excited for more options for my patients who are, my present patients as well as my future patients.
Thank you so much.
You're so welcome.